It is estimated this year alone, more than 80,000 people in the U.S. will be diagnosed with bladder cancer. Now, among those, more than 17,000 will die from that cancer. May is Bladder Cancer Awareness Month, and here with us this morning is Dr. Sanjay Patel with Stevenson Cancer Center and one of his patients, Sean Kleins. We appreciate you guys joining us this morning. Thank you so much.
Well, thank you for having us.
All right, so let's talk about bladder cancer. First off, that's not the first cancer that would come to mind. Second off, the statistics are high. Why are they so high?
Well, yeah, you're right. Bladder cancer, there's about 80,000 new cases that are going to be diagnosed this year alone. And if you look at it, 1 in 4 men will be, or excuse me, it's the 4th most common cause of bladder cancer. And it's one of the most prevalent cancers, so meaning that a lot of people get diagnosed and they have it and they live with it. About 200,000 patients will have it. And it's a long treatment process. There's a variety of different things that we do, and it makes the time course for treating this cancer quite long, and so it's quite common.
So what are the first symptoms of this?
Well, in general, most patients will present with blood in their urine, and it's typically painless, and usually it's pretty short-lived, and so oftentimes most patients brush it off and think, oh, it's probably nothing, especially in women, where a more common cause of blood in the urine is urinary tract infections, and so we oftentimes see that the diagnosis is delayed in women, and even in men too, because a little bit of blood in the urine, it goes away, I feel fine, it's not hurting me. That's usually kind of what happens.
Is there a certain age group where it hits more, or is it kind of all ages?
In general, it's typically older patients, 60s, 70s, 80s, although it can occur in younger patients. Typically, the average age is about 70 years old.
Okay. Sean, if you don't mind, can you tell us a little bit about your story?
Yeah, in 2016, I was diagnosed with bladder cancer. I was kind of the same thing that he said before. It's kind of misdiagnosed. They thought it was a urinary tract infection, so they tried treating it for about a year. And then when I had more symptoms, I actually had another test done, which then put me in touch with this gentleman here and found out that I was stage 3, stage 4 bladder and prostate cancer.
So where are you at right now?
I had the surgery done where I had a new bladder put in and my prostate removed. It's called a neobladder, and it was all done by robotics, which is incredible how they can do that nowadays. And then at my annual checkup, I found out that my cancer's come back.
I'm so sorry.
No.
So what are the next steps from here?
I've gone through 20 rounds of radiation over the last month and a half, and I've just now started immunotherapy. I have a little different situation. My cancer is a little different than the typical, of course, being 46 years old and having bladder cancer, you know, it's kind of at a younger age. So right now we're doing immunotherapies, and hopefully with my health and being a little bit younger, hopefully my prognosis will be a little bit better going on down the road.
Well, we are hoping and praying for you, man. Hopefully, you know, it's going to turn out good. It will. And Dr. Patel, kind of going back to you, I mean, he's in his 40s. How often is that? That's kind of rare? It
is pretty rare. Usually those patients that present at an earlier age usually have a variant of bladder cancer or a different type, not the standard run-of-the-mill bladder cancer. We tend to see it at our cancer center because we get typically a lot more of the advanced cases referred to us, and that's kind of how we met Sean, was through that diagnosis. But so, it is uncommon.
Right. So the first thing to look for is blood in the urine. Once you see that, what is your next step?
So if you have blood in the urine, you should see a urologist, and you should have a workup, and it's a pretty straightforward evaluation or workup. One is a CAT scan. Another one is going to be a scoping of the bladder, and the third is a urine test. And those are the 3 things that you need to have for anybody who's got blood in their urine, typically that painless, you know, it's not hurting me, blood in the urine. Could it be a urinary tract infection or a kidney stone? Those are the most common causes of blood in the urine. But if you have blood in the urine, you have to get evaluated.
Okay, and so it's saying right here, 17,000 people will die from this cancer. Where are you guys on treatment at this point? Is it getting better? Is it kind of stagnant?
No, you know, actually it's an exciting time with bladder cancer now, and there's 3 phases of bladder cancer. If you look at it, kind of the early stage where it's not really invasive. Then you've got the invasive type where you have to do a surgery to remove the cancer, and then you've got the advanced type where it spreads beyond the bladder. And I think that if you look at the early patients, we have enhanced detection. We have the technology to look at these tumors and inject a chemical that will actually make it light up. So it's kind of like looking at infrared vision or night vision to see these tumors, and they basically light up, so you're able to see them all. So it's called blue light cystoscopy. We also have advanced immune-based therapies, meaning we rev up patients' immune systems to to help treat the bladder cancer. And I think patients who have cancer that's a little bit more advanced, we can remove the bladder and reconstruct new bladders using the robot. So you have small incisions instead of a big, large one that's half of your abdomen, so you recover quicker. And I think in the advanced stage, we have a lot more treatments. I think for the longest time, we only had one treatment for if it's spread throughout your body. Now there's a whole slew of treatments coming out. And in fact, at the Cancer Center now, we have 3 or 4 really exciting clinical trials, cutting-edge treatments for these types of cancers. So it's a really exciting time with bladder cancer, I think in all cancers in general.
Okay, and I'm getting told to wrap up, but I do want to get this out. Stevenson Cancer Center is having a walk on Saturday.
That is correct, yeah.
What time?
8 o'clock in the morning.
8 o'clock in the morning?
Yep,
Okay.
and we ask people to kind of come a little early. We're having a silent auction to help raise money for cancer awareness. And I think it's our 2nd or 3rd year doing the walk, and it's growing every year. We got some fantastic people that have put this together for us.
Okay, and real quick, where can they go for more information? Is there a website?
I believe our Facebook page,
Okay.
we have it out there for the Oklahoma Bladder Cancer Awareness page.
Okay.
They can find all the information on there.
All right. Well, both of you guys, I appreciate y'all so much coming on here. I really do. And hopefully we can get a lot of people out there on that walk. All right.
Thank you very much.
Yes,
Thank
thank
you. Appreciate it.